evening, everyone, and a very warm welcome to each of you who have connected to us and those of you who are still trying to connect to us. So I would hand it over now to Mr. Bijoy, the President. Over to you, Bijoy.
Thank you so much, Reena. I hope everybody can hear me now. A very warm good evening to one and all. On behalf of Federation of Indian Nurses in Qatar, I would like to welcome all who have joined in. And this is our first webinar and the most apt name which we have given, that is the looking beyond the obstacles. Being isolated for 14 days, it's really a terrible feeling. So, and the second thing which I've learned from this is like here in Qatar, now the climate, it is around 45, 50 degrees. But I used to open the windows of the hotel where I was staying, and I was always looking out of the windows to see what the world is like. So I've learned that the comfort which comes from a luxury hotel, you're not in a position to enjoy all that. I've learned that I have a lot of topics to discuss with my wife. That is almost, this is the first experience where I stayed with my family for 14 days. Even when we go for vacation, we just roam around. We don't get to meet each other. And we hardly have topics to discuss. But these 14 days, we had enough topics and we had enough subjects to discuss on. I've also learned that we don't need much toys. We don't need gift to make our kids so happy. They were so excited. So being with them was the best experience what I could ever share with them. And moreover, what I've learned is like, from this experience, I've learned a fact. And in fact, this is something which COVID has left behind. This is a big message which COVID has left behind for all of us. All this crisis will pass away. It will pass on. This will not last forever. And this crisis too will pass. And we are strong enough to overcome this.
In dealing with the threat of COVID-19 and in ensuring our other essential health services remain available, nurses from different nationalities, specializations, ages, and experiences have come together and have widely collaborated with other healthcare professions. Without the courageous work of the nurses, definitely needs an applaud. So can we have a silent applaud to the wonderful work our nurses are all doing? Without any further ado, let me officially open it and welcome our first keynote speaker for the evening, Sister Sumaya bint Ibrahim. Over to you, Sister Sumaya.
Thanks to FINQ to give me this opportunity to participate and to share our experience. So as you introduced me before, I'm Director of Nursing and Midwifery in WWRC, Women's Wellness Research Center. You can hear when we started this pandemic and tragic period, so I was selected by our hospital and our leads to be a core COVID team to coordinate. Okay, so we tried as a tertiary hospital to keep our hospital COVID-free, but still we adapted and we prepared other alternative. So we were assigned to prepare other maternity in other hospital, which is designed by this one is SWIC. This is System-Wide Incident Command to be for designed for COVID patient. So we went and we prepared delivery rooms. Okay, we transferred equipment, we redeployed midwives and nurses. And I want to give special thanks for our nurses and midwife. As you know, here we are tertiary hospital and we have different nationality. We have Indian, we have Tunisian, we have Philippines, and really, in my job, I'm doing 50% clinical and 50% administrative. But during this COVID time, I discovered so many things. I discovered how great our nurses and our midwife.
Thank you so much for FINQ for giving me such an opportunity to participate in this program. Especially, I take this opportunity to thank my friend Mr. Siju, who is working in Qatar. He's the one gave me an invitation. So thank you so much, Siju. And I welcome you all.
Really awesome because my wife herself is a nurse and her kid, she was all alone, had to stay isolated after work, which was like really not a pleasant thing to have when you come back from work. You get home and you can't go to your kid, you can't see, you can just wear her and you can't talk to her or you can't cuddle her. So that was a bit unpleasant experience we had from when we were working at the time of this pandemic. But the support what they were giving was really awesome. So how the kids were just.
I would like to introduce and welcome our second keynote speaker for the evening, Mrs. Rachel Libang. Good evening, Mrs. Rachel.
My nurses, who contribute to 60% of the team. Nurses have stepped up and stepped beyond their calling. In the risk zone always, the nurses were in the forefront, are in the forefront, working round the clock, right from the patient. So all of you there who are hearing me now, this is the time. As the doctor is the head of the hospital or the healthcare, nurses are the heart of the healthcare.
And initially, actually in Kuwait, we have a dedicated hospital for COVID cases. So none of the patients was coming to us. So initially we were happy that all the patients will go to that dedicated hospital. The name of the hospital is Jabar Al Ahmad Hospital, but all the facilities are available. But later, when the cases increased, the government has started new ICUs, new field hospitals everywhere in all over the hospitals. In all general hospitals, they started everything, ward, ICU, casualties, everything, especially for COVID cases. So staff became panic. They were thinking about their family.
So from Ireland perspective, it wasn't very bad as other countries in Europe. Altogether, there were 25,000 people were affected, 25,715 accurate, and there were 1,700 people died because of COVID. But saying that, the country had done its level best, its maximum. It's really done really well, responded very well towards the pandemic. But
let me introduce myself. I'm Prasanna Parakal and representing San Antonio Indian Nurses Association. Our mission is to serve as a community excellence to the professional development, and our goals are, we act as a professional wellness advocate. We conduct medical camps, we conduct screening programs, we analyze and publish information and participate in conference, workshops, seminars. So my advice for the nurses today is our aim is achieving zero harm to the patient, and achieving zero harm to the patient, it is not, you are not telling the medicine team or nursing team, but we have to provide the adequate resources. Here in this COVID-19 pandemic crisis time, we have to supply the adequate PPE, personal protective equipment, the mask, goggles, and we have to provide adequate resource for donning and doffing places. We need to have adequate personnel to cover that area.
Stress management was really, especially for those positive staffs, they were really stressed, especially the initial 1 or 2 months. But as a director, I used to call everyone almost every day, or I used to chat with them through WhatsApp and made sure that they are stress-free. I did my best with the help of my team, and I instructed all my charge nurses and head nurses to contact almost all the positive staff every day to help them.
Hi, good evening. I deem it a great honor and privilege to propose the vote of thanks on this memorable occasion. Let me first of all start by giving glory to the Almighty God for making today's webinar a resounding success. The FINQ family thank each of them for their unstinted support. Event like this cannot happen overnight. The wheels start rolling weeks ago, and we have been fortunate to be led by our president, Mr. Bichai Chako, and backed by a team of our very motivated and dedicated FINQ Managing Committee and FINQ Media team who work behind the scene. Thank you, dear ones. My heartfelt thanks to Ms. Reena Philip, FINQ Editorial Lead, for leading the webinar. Last but not least, I thank you, my colleagues, for their cooperation in making this function a resounding success.